Sir, as you can see in the slides, we have more than 124 million doses up to date that had been given to the all decisions globally. And the daily pace has reduced from 6 million last week now to 4 million. And then UK has completed coverage of the first segment of elderly and on track on full coverage and willing adults. And they are also trying to finish their vaccinations as soon as possible time. While India successfully inoculates 4 million in 18 days. Ito po ang isa sa mga tinitingnan po natin na mga good stories at saka mga lessons learned in India. And then also, in terms of the development of the vaccine, we have a good news that Gamaleya boosted by trials result with the verified result of 91.6 efficacy. And it is one of our portfolio, the separate vaccines that we are trying to procure. And then also, we have also some information on the outbreak development raising some concerns on vaccine performance against the new variants. So ito po yung nagiging isang concern na yung ibang mga vaccine na nabili natin ay kaya pong i-cover yung variants ng UK, yung South Africa, at saka yung sa Brazil. And luckily, we have some in our portfolio, like Novavax and Johnson & Johnson's, who were tried during their clinical trial. It was tried in UK, in South Africa, and also in Brazil.
So just to make it clear to the people, magsasalita na lang ako ng Tagalog. Subukan ko. So in other words, Secretary Galvez, yung bakuna na datating sa akin is as equally good in terms of efficacy and potency against the new variant.
Yes, sir. Yung ibang
It can take care
Yes,
of itong ngayong variant that is making the rounds in, well, it started, I suppose, they say, sa UK. So, ito ngayon, covered ito.
Yung sa trial po ng Johnson & Johnson's and also sa trial po ng Novavax, which we have included in our portfolio, kasama po yun. Kasi yung Novavax po, kumuha po tayo ng 40 million doses.
COVAX is the one that's being distributed by the WHO.
Yes, sir. The Pfizer and the AstraZeneca po, sir, na sa ngayon, sir.
Okay. Okay. Thank you.
Yes,
Salamat po.
Yes, sir. Next slide, please. Sir, during the last week, sir, together with Secretary Duque and other IATF members, we have successfully visited 14 cities. And some of our staff, like Yusek Motahe, he visited also Cebu and look for the preparation of the other areas. And also Davao, sir, in preparation. And then also during our meeting with the LGUs, we saw that many of the LGUs and almost all of them are well prepared on the different tasks that have been given to them by the DILG. The DILG already directed, given them the memo, magkaroon po silang ng early preparations for the simulations and rehearsals para po sa inoculation nationwide. And nakita po natin talaga, kami nila Secretary Duque, nakita po namin we are very satisfied dahil kasi po tuloy-tuloy po yung simulation and rehearsal na ginagawa po ng ating mga Metro Manila mayors. And then next slide. Yes, sir.
Originally, my order was to have the vaccination taking place in sa mga istasyon sa police, tapos sa mga military installations in the far-flung areas. In the far-flung areas, if there is no suitable venue, then the military camps would suffice. But dito sa urban areas, ganito kasi may ano ako na sa police station or military installation. Apparently, sa tingin ko, sir, hindi magkasya kung gano'n lang. So we'll have to take in, well, anyway, talagang kanila man ito. They are the indispensable partner of the program. Ang mga local officials, sila lang ang mamili sa mga gymnasiums o kung kulang talaga, then my order is to utilize the public school. Hindi pa naman ginawala pa naman klase. Public school buildings. Kung wala. If there is no malaking coliseum o gym, then we will utilize the schools. Yeah, that would be the kung maaari lang, wag muna, but I do not see any objectionable thing there. Total, pang injection man lang, wala man nagkasakit. Well, maybe 1 or 2 or 3 mag-sleep. But fundamentally, it is really giving people the shots to make them healthy. So yan ang akin, ang eskwelahan na lang. Pagka, but the police and the military should help discipline there should be in the rural areas kulang yung police. Especially yung mga sityo-sityo na, it would be nice to see the military also helping out. So, thank you. Go ahead, sir. Continue.
Sir, may-utilize din po ang ating military hospitals dahil po ang mga target po natin, yung mga health workers at kasama po yung kanilang mga pamilya. Magagamit din po yung military hospitals in terms of yung inoculating the defense and military and uniformed soldiers personnel and also their families. So kasama po yan sa mga vaccination centers na tinitingnan po ng mga LGU po natin. At nag-usap na po kami ng military na talagang magagamit po yung military hospital, considering also the military hospital personnel is also considered as our health frontliners. At doon po ang isa sa mga una po natin na priority sector na bibigay ko po mamaya po na priority sector na targeted na natin i-inoculate. So magagamit po talaga po, sir, ang yung mga military camps, considering also sa ibang mga areas talagang wala pong malalaki na space. And we believe aside from school buildings, yung military camps po ang pwede po talaga kasi pwedeng maging orderly. And also, yung military at saka yung uniform personnel, they will provide support, particularly yung sa security ng transportation ng ating mga vaccines. At the same time, sila po ang magpo-put order so that the social distancing and also yung tatawag nating implementation of the minimum health standard will be in place doon sa vaccination area.
I'd like to thank the military for that, offering the services of the men and the venue itself. There was this thing that yesterday I wanted to talk about, but okay naman siguro. Ganito, sir, yung pala. In areas, total, this is a nationwide, is the word telecast correct? Buong Pilipinas to, we might not be able really, because the vaccination is starting, we might be able to issue this appeal. Not a warning, I'm appealing. I am appealing to the Communist Party of the Philippines, yung pinaka-umbrella. I don't consider yung mga NDF, pati NPA. Yung the Communist Party of the Philippines must guarantee that the vaccines in the course of their being being transported to areas where are no city health officers or medical persons, na huwag ninyong galawin ang medisina. Allow the vaccines to be transported freely and safely. I am asking you now to observe that rule because that is for the Filipino people. As I have said, the money belongs to the Filipino people. It credits, the credit goes to no one. Sa inyo ito, mga taong Pilipino, pera ninyo ito. So, natural lang na kayong mga members ng Communist Party of the Philippines and the allied in PA, in DF, or whatever, kindly observe the rules of humanity. Hindi naman kailangan natin baka maulit ito yung mga pera, yung mga pantawid na pag-deliver, ini-intercept ninyo. It's abhorrent, but you can redeem it by just seeing to it that there's a fair atmosphere or environment obtaining in the places where you are, kayo. At nandyan yung mga taga-gobyerno. Yes, sir. Continue. Para makiusapan ko na kaagad.
Sir, as I have said earlier, sir, na yung mga vaccination centers natin, nag-designate po ang ating mga mahal na mayors at meron po silang tinatawag na designation ng mga mega vaccination center at saka po meron silang community vaccination center. Ang lessons learned po doon, nakita po natin for example sa Taguig, nag-build po sila ng vaccination center, 3 malalaking vaccination center sa Lakeshore which is isolated. Talagang ma-observe po yung social distancing. Kaya po nakita natin kung makikita po natin yung pathway, napakaganda po ng ginawa nila. Halos lahat po ng ating mga LGU sinunod po yung 7 steps na binigay po na guidelines ng DOH. At the same time, yung iba sinimplified nila into 3 steps. Sir, as we follow yung guidance of the President to have a safe, sure and secure vaccine. Ito sir ngayon sir yung vaccine na darating sir ngayong February, yung 117 na Pfizer. We will make sure na ito sir talagang walang mawa-wastage sir. So sa ngayon sir nagkaroon na tayo ng ng simulation by the DOH. Pero ngayon sir magkakaroon tayo ng interagency simulation kasi marami pong agency po ang tutulong po sa atin. Nandiyan po yung DOTR, nandiyan po yung NAIA Management Airport at saka po nandiyan din po yung customs. At nandiyan po yung lahat ng mga third party provider natin na pwedeng tingnan natin para at least hindi po sila magkaroon ng delay sa arrival po ng po natin.
Kaya itong sir, may I just address myself to every government worker. Lahat tayo, like us, also a government worker. Do not delay and do not hinder or obstruct the smooth flow na nakikita ninyo ngayon. From the time of the arrival to the time of clearance, hindi naman kayo well, of course, maybe ang trabaho lang ninyo, customs is magtingin. You have no business na buksan-buksan yan dyan. You are not allowed to do that. I am not allowing you anybody there sa airport na magbukas-bukas. Then yung loading, the transport, you might want General Galvez. I'm answering dyan so that you would find it easy really. General ka naman talaga eh. Itong mga the police, the PNP should provide escorts that would ensure the fastest way of for the vaccines to arrive in their storage, at saka yung even in the matter of transporting it from one facility to the other, ihati doon sa mga local governments. The police should provide that kind of mobility. Yung mga tawag nilang haggard will provide the fastest way of doing it. Lahat nasa gobyerno nitong, tignan ninyo ngayon, tignan nyo kung saan kayo banda, arrival, then customs, then the loading, the transport. Huwag ninyong pakialaman yan. Leave it to the task force. Sila ang bahala niyan. Si General Lorenzana, Secretary Anya still on leave, General Galvez, and Dr. Doke. Sila ang they call the shots there. Nobody else. In the matter of ensuring the smooth operation of this vaccine, reaching it to its ultimate beneficiary, the people. Pagdating doon para turok agad.
Yes, sir. We already had an initial coordination with the different agencies. Kaya po, sir, makita po natin from arrival. Yung customs, sir, talagang meron silang one-stop shop. Secretary Dominguez already directed Commissioner Jagger, Customs Commissioner, na talagang mabilis po yun. Pinaka sir natin, sir, is not more than 30 minutes. Kasi po talaga lang i-inspect para po ilan yung nanahan doon. But definitely po hindi na po bababa yun sa aircraft. From aircraft, dadalhin na po kaagad doon sa sa naghihintay na tinatawag nating truck. And then from there, meron po tayong we already coordinated with the DILG and Chief PNP na talagang meron pong escort, mobile escort. At gagawa po tayo ng tinatawag nating special lane para at least pagpunta po sa RITM, minimal lang po yung very minimal po yung time. And then doon na po i-inspectin yung mismo sa storage facility. So that yung stability po ng mga vaccine will be maintained. So gagawin po namin bukas po, sir, talagang i-run through po namin para makita po namin yung actual. And then kung may mga defects, ayusin namin sa lahat natin defects. Actually, nandun po lahat ng mga primary secretaries at saka si Jagger po pupunta po doon. Yung si Secretary Tugade, we invited him. And then we invited also Secretary Lorenzana. And even the Chief of Staff and also the Chief PNP will be there. Para pagka po natin is talagang yung mga chief at saka head of offices will be responsible po para at least yung guidance nyo po na hindi ma-delay ang pag-deliver ng vaccine doon sa ating national warehouse ay matutupad po, mahal na President. So yung po po natin na we will ensure that your directive is
itong storage pati warehouses na where the vaccines are deposited, talagang malamig to, ha?
Yes, sir. Actually, sir, kinabagan po kami, sir, kasi ang lamig po, sir. Kasi mga few minutes lang po, sir, kasi talagang napakalamig.
Tigas ka?
Negative, sir. Actually, sir, nagkaroon po ako ng sakit ng tiyan afterwards kasi talagang napakalamig po, sir. It will take you, sir, mga few seconds kasi yung refrigerator, sir, nakita po natin yung refrigerator, talagang malamig po, sir, -70, -8. So next slide please. Yung priority, ito po yung priority, sir, nating sir, Kasi meron po tayong tinatawag na WHO SAGE, yung tinatawag nating yung kanilang mga expert na pati yung ating expert na 45 expert na talagang nilatag po yung kung sino yung mga priority based po dun sa tinatawag na yung burden of disease at saka po yung reduction of mortality at saka preservation of our healthcare system.
Funny, but yung inaano nila, yung priority nila, well, that was also our original
Yes, sir.
plan even before we were discussing the arrival of we were discussing already the priority of persons would get the COVID. So, parang nasunod lang rin o may kunting parang nakita ko, hindi. Kasi lahat na sinabi natin, o sa lahat ng sinabi ninyo ni mga doktor, nasunod talaga.
Yes, sir. Actually, sir, ito general classification lang po ito. Pero kung tutingnan po yung yung NITAG the resolution, nando po specific po yung even yung mga hospital, yung mga name ng hospital na bibigyan po ng COVAX na uunahin. Sunod-sunod po na doon po. Ito lang po, pinakita po lang natin na talagang uunahin po na natin yung workers in frontline health services to preserve the burden of our yung healthcare services po natin. Dahil kasi po kung just in case na ma-prolong pa rin po yung COVID, at least yung healthcare system natin hindi po mag-collapse. At the same time, kasama po natin dito yung mga senior citizens kasi ito po ang pinaka-vulnerable. And then yung sinasabi nga po ni Senator Bongo, yung poor communities, according to WHO, yun din po ang pinaka-vulnerable kasi doon sila sa crowded habitation. So yun po ang inunan. Then later on po yung tinatawag nating mga government essential workers para po tuloy-tuloy po yung services ng gobyerno. So kasama po dyan ang DepEd, kasama po ang DSWD, and then also yung military and uniform personnel. And then later yung other frontliners, nandito po yung tinatawag nating economic frontliners.
So, are you true?
Thank you very much po, sir. And we hope that sir, yung lahat po ng preparation po natin will succeed, sir. And maraming po salamat sa lahat po ng guidance po, sir.
I'd like to thank you for the hard work that you are doing. So, we go now to the Secretary of Health. Sir, do you have anything to...
Just a very short update lang, sir. Nothing much, but can we have the presentation slide? Ito lang, sir, yung total cases natin. Umabot na tayo sa 538,995 as of today, February 8. Ang active cases natin ay 27,992, equivalent to about 5.2% of all cases. And these active cases are currently admitted and isolated in the appropriate temporary treatment and monitoring facilities. At ang recoveries po natin, Mr. President, umabot na po tayo sa almost 93%, equivalent to 499,772 recovered individuals. Sa deaths naman po natin, meron tayo 11,231, which is about 2% ang case fatality rate po natin. Can we have the next slide? Ito naman po yung whole genome sequencing update as of February 7, 2021. Meron po tayong additional or karagdagan 25 samples ang sumailalim na po sa whole genome sequencing nitong nakaraang linggo at 8 mula rito ang naitalang dagdag sa mga nagpositibo dun po sa tinatawag natin B.1.1.7 UK variant. Sa kabuuan po, meron tayo 1,227 samples na ang ating pong na-sequence at 2% lamang ang positibo sa UK variant. Pangkaraniwan ang B11.63 lineage or ito po yung galing sa Hong Kong sa mga variants na naitala. Patuloy din naman sa ilalim po ng inyong paggabay, Mr. President, pinapalakas po natin ang biosurveillance efforts at patuloy naman namin pong bibigyan ng update patungkol sa anuman panibagong impormasyon dito po sa atin whole genome sequencing update. So, next slide please. Ito lang po nagpapakita yung global perspective of where the Philippines stands. Halimbawa po sa total cases, ang Philippines ay number 32 at 530,000 plus cases. Noong October po, number 18 tayo. In other words, mataas na mataas yung bilang ng kaso natin ay napakamataas. We were number 18 throughout. Nung dumaan ng November, December, at napalakas po natin yung atin pandemic response with the help of the local government units and also commending the discipline and the compliance of our citizens with our minimum public health standards. Kaya bumaba na po ang ranking natin, as number 32 na po tayo. Tapos sa active cases naman po, number 44 tayo. We only have as of today 27,992. Malaysia, which is even a smaller country than us with a lot less population, with a smaller population, ang active case nila 51,241. Indonesia 176,291. So ibig sabihin po nito, talagang gumaganda yung atin response, Mr. President. And if we go look at the cases po per million population, ayun, as number 134 na po tayo, Philippines, 4,987 per million population. Yan po yung atin morbidity rate sa COVID-19. Samantalang yung iba, kung titignan ninyo, Mr. President, ang tataas. Singapore is even bigger in terms of their total cases per million population. They have 10,200 per million population. And all the rest, they're about 5 to 10 times bigger their case per million. So, ibig sabihin na naman, umaayos po tayo, gumaganda po yung atin response or mortality rate. Sa 114 tayo, Mr. President, at 101 deaths per million. Samantalang yung iba, tingnan nyo sir, halimbawa, ayon, sa United Kingdom, 1,651. It's like 15 times more than the Philippines, yung number of deaths per million population. The United States of America, 1,377. Italy, 1,505. Samantalang po tayo, 101 per million population. At ganun din po sa case fatality rate, we are number 73. The lower we are, the better our ranking. Ganun po yan. Sa Philippines, 2% ang case fatality rate natin. We're lower than Myanmar and Indonesia. Yan po ang atin pong datos sa ngayon. Next slide. Yan lang po muna, Mr. President, yung akin pong maiksing presentation at handa po akong sumagot sa inyo pong mga katanungan. Salamat po. Sir.
Well, actually, I think that we have reasonably, we did our assignment, and ganito na lang, we are waiting for the vaccines to arrive and to immediately implement the required mandate, and that is to mabakunahan lahat. And we will do it as fast as the vaccines will come in. So yun, we have explained to the people why we cannot give it indiscriminately to any local. I am just talking of government entities. Wala akong pakialam sa ano. As fast as we can, as fast as we receive them, we distribute them, but you must have the facility, I said, to ensure that the integrity, yung visa ng vaccine ay hindi masisira. But eventually, we will solve all the problems connected with this. We will survive. And by the end of the year, mukhang medyo na tayong hindi na pinakamaganda, but magandang resulta sa pagod natin. And I'd like to assure the people that we have really ginawa namin ang itong si Secretary Duque pati si Secretary Garbels and Secretary Lorenzana, and of course in this post lang si Secretary Anyo. The task force na sinabihan ko yung mga noon na gusto ko military ang patakbo kasi para sa akin personal ko lang naman yan na they have the marunong sila magpwesto kung saan-saan. Sanay sila kasi sa yung 1, 2, 3, 4. Hindi yung ibang 1 tapos 3 tapos maging 2 tapos 5. Yun ang sinasabi ko. Yung otak ng iba ganon. So just to make sure that this is an important undertaking and that it should be done correctly and with the list, kung meron man, with the list of mistakes. So, maraming salamat sa inyong dalawa. Yes, sir.
Sir, we would like also to thank yung Congress, sir, kasi magre-report kami ni Secretary Duque dahil tatulong din po sila na ipapasaro nila po yung Bayanihan 3, pati po yung Senado, yung mga kailangan po natin na mga law na maipasa para matulungan po tayo na mapabilis po yung pagpunta po dito ng vaccine. Unang-una po yung indemnification fund na kailangan din po yun at saka po yung tinatawag natin yung free on taxes at saka yung custom duties para po mabilis po yung yung pag-transport po ng ating vaccine from the airport na wala na po talagang customs inspection at saka po natin. So tumutulong po sa atin ng Congress at saka po yung Senado, pumuno po nila Senator Bongo para at saka po nila Ma'am Amy na magkaroon po ng ng legal cover also yung mga LGUs for the advanced market commitment. So meron po silang ginagawang legal sir na pwede pong mag-advance ng more than 15%.
Well, let me echo your sentiment. I also would like to thank the Congress of the Republic of the Philippines for understanding us and giving us the support, the critical support that we badly need to discharge our duties. Wala akong masabi dyan in a matter of yung pagtulong sa problem. That is why in fairness sa Congress naman na pera man kasi ito ng tao na hindi appropriate, they give us the money that we dito sa implementing arm ng government, the executive department, the ones doing the actual work, the most requirement or my demand would really be just to follow the rules laid down by government. Anyway, lahat na dito ngayon may rules from the accounting to up to the time of the procurement and the distribution and of course the implementation of the mandate. Sundin lang ho ninyo, including the local governments. Just follow the rules and we will be happy lahat tayo. Sundin lang ninyo para walang problema. Just follow. Why? The reason is really very simple. It is the people's money. Tapos inappropriate ng Congress para dito. So I do not really begrudge them if they are over strict sa mga bagay-bagay na pagpagastos nito. And they will see to it that the money is not wasted, and worse, it will go into corruption. So, salamat po sa Congress. Sama-sama tayo dito. Well, as I promised to the people, they have every right. And I said during many months before that I will dedicate the last remaining year of my term against totohanan ko itong drive na against corruption. Patagal na ito silang nawala, but dapat lang ninyong malaman kasi maybe to serve a lesson to everybody. Sa Department of Agriculture, ang number 1 si Fee Lumawag, Cashiering Staff, Philippine Rice and Research Institute. Violation of RA 6713, dismissal from the service. Matagal na to pero kailangan malaman ninyo. Rodolfo S. Escabarte Jr., Manuel Gaspar, Chief Science Research Specialist Rice, Supervising Science Research Specialist, si Edgar Libertario, Supervising Science Research Specialist, Philippine Rice. Kasayang nitong mga tao na ito. No, we have ditong rice. We are known for inventing the quality of rice for everybody. Mario Mobilon, Chief Science Research Specialist. Dismissal to lahat. Pati si Artemio Pasalio, Division Chief 3. Dito sa Abdul Wahab Bayaw, Chief Administrative Officer. Estrella Sabay, Accountant 2 and OIC Accounting Office. Mustafa Ismail, Regional Executive Director. They're all dismissed from the service. Now, ito ngayon, last, itong nangyari sa itong mga Lopez of companies. Ang Congress is planning to restore the franchise of the Lopez. Wala akong problema doon kung i-restore ninyo. But if you say that if they can operate, kung may ano na sila, no, I will not allow them. I will not allow the NTC to grant them the permit to operate. Kung ibigay ninyo yung franchise because it is within your power to do it, go ahead. Alam mo bakit? Unless and until mabayaran ng mga Lopez ang taxes nila, I will ignore your franchise and I will not give them the license to operate. Kalokohan yan. Parang binigyan mo sila ng price for their being for committing criminal acts. Ito yung pinagbili ng Lopez, yung Lopez of companies kasi maraming utang. So binili nila na lahat, pati yung mga utang pinagbili ng Lopez doon sa DBP. Mayroon akong kulang dito because I am not quite familiar. Ito lang ang akin eh. Pero ito dumating sa akin and I said in my official capacity as a government worker. Ngayon, pinagbili ng Lopez doon sa DBP. Binili ng DBP. Tapos, merong batas, SPAV. Yung SPAV is a law that was made to help ailing banking institutions. Ayawan ko, ito bangko ito, pero napabili nila ang kanilang utang lahat doon sa DBP. But after a few years, binili ng DBP uli yung pinagbili nila. Pinagbili nila sa DBP yung pinagbili nila. This time, medyo wala na yung mga utang-utang. Condone, kung ano-ano ang nilagay nila. Ngayon, unless it is clear, I think Congress, I understand, started an investigation, but stopped nung dumating na sila dito kay Lopez. There were so many investigations about banking, except that pagdating sa kila Lopez, kinuwento sila. So, nagkakaroon tayo ng problema dyan. Dumating sa akin ito in official capacity. Ang magawa ko lang nito is I think I'll pass it on to the Ombudsman. Para sa akin, ang Ombudsman ang pinaka independent body na mag-solve ito. Gusto ko lang magbigay sa kanila kasi pera ito ng tao. It's the government money that is involved. I would like to repeat it again. Itong pangbayad natin sa bakuna, hiniram natin ito sa DBP, pati World Bank. Wala kasi tayong pera. Ngayon, pagdating na sa bayaran, kung tapos na lahat, ang ang mga manufacturers, ang nagpabili sa atin ng yung Pfizer, lahat, magkolekta sila, hindi sa atin. Doon nila kunin ang pera nila sa World Bank, pati DBP. So, walang korupsyon dito kasi walang hinahawakan ni sino man sa amin dito na bilyon. So, ganon. Ganon ang sitwasyon. Kaya, masakit sa amin na basta na lang sweeping allegations about corruption. Iyon ang pakiusap ko lang rin sa mga members ng Congress. In the meantime, may nagsabi na, wala daw kayong sinabi. May isa sa inyo nagsabi, huwag nang sabihin dito, magkaano lang tayo. We'll just go into a rigmarole. Ika nga, ikot-ikot na walang hanggan. So yan, yun lang rin ang idagdag ko ngayong gabing ito. Wala naman siguro. May iba pa, as lalabas yan, isasabi ko sa inyo. So, kung wala nang idadagdag sila, ikaw, Senator Go, wala na. Maraming salamat sa inyong pagtangkilig pagtangkilig sa programa ng amin dito sa gobyerno. Maraming salamat po at magandang gabi.